my name is Danielle Martin. I'm from the Reading Hospital School of Health Sciences Paramedic Program, 2013 to 2014. I'm going to show you the proper way to synchronize cardiovert someone today. My willing volunteer here, Kirsty Trauman, will be helping me out. Alright, so there are two rhythms that you would have to cardiovert. One of them would be VTAC, which is shown on your screen right now. It's a ventricular rhythm. It'd be VTAC with pulses that you would have to cardiovert, anything greater than 150. Another rhythm that you might have to cardiovert would be supraventricular tachycardia, which would be a narrow complex rhythm, unstable, and that would be anything over 150 for your heart rate. I'm going to show you patch placement now. For synchronized cardioversion, it's the anterolateral position. And you're going to start with the right side, and that'll be just below the clavicle to the right of the sternum. And the left side is going to be mid-axillary, centered between the 4th and 5th ICS. And then you hook it up. So now we're going to show you the syncing process, which starts out with confirming your rhythm, which we got an SVT right now, and pulses. And we're going to then have the pads on, which are already on in the correct position. Then you're going to choose the lead with the most prominent QRS, which we have on. We're going to go to lead 3, or press the sync button, which we already have, and we want to confirm the sync dot, which is this thing right above each QRS that is the safe zone. There's also an area called the unsafe zone, but all of these are in the correct position right now. So after that, you're going to push the record button, which we won't. We'll save some paper here, but you want to push the record button. So you would go at this point to charge your synchronized cardioversion, and you would start at 100 joules. So we're going to go there. Yes, we are. Okay, so you go there, and you would charge your joules and start at 100. But we're not going to do that. We're going to disarm. And if that does not work, you would continue to charge, and you would go up to 200 at this point. That would be your next one. And 300 would be the third shock. And then you would go to 360 for your final. And then if that doesn't work, you would have to go to medication, get the IV started, give some medication, and you would have to synchronize cardiovert again at that point. Contact medical command, advise them what you got. So you also want to take into consideration that if your patient is conscious and talking to you, you might want to use some kind of sedative such as Versed, because it is obviously going to be a very painful experience. So once you get your rhythm back, you were aiming for your normal sinus rhythm. If you're able to get that back, or any legitimate rhythm, you want to do a 12 lead, reassess your patient's vital signs and their level of consciousness, and just keep that reassessment and let the hospital know what happened.